Good afternoon. Welcome to FTA's listening session. To get us started, we will turn to FTA Chief Safety Officer, Gail Lissy.
Hello, everyone, and thanks for joining us for the second listening session of FTA's Transit Renewal Initiative. I hope all of you are safe and well. I'm Gail Lissy, joining you from Fort Worth, Texas. I am currently serving as the Acting Associate Administrator for FTA's Safety and Oversight Office, which provides me with a national perspective on the industry's efforts. One of the hallmarks of FTA's Transit Renewal Initiative was created to make sure people, frequent riders, occasional riders, and those who are not yet riders, know that transit is safe, clean, and reliable. I appreciate everyone joining us today for what I am sure will be another informative conversation about best practices to help us reinforce that America is open and transit's open. At our first listening session last Friday, we heard a lot of great approaches to renew ridership, such as defining public transportation as a people issue, meaning a focus on the value of transit and getting frontline workers and others where they need to go, the importance of increased communication with customers, and how we can place a greater emphasis on quality and not necessarily quantity on transit. It was really impressive. I know I learned a lot. Today, FTA is hosting this listening session with a focus on safety. FTA's Administrator Nuri Hernandez and all of us at FTA are committed to safety. Of course, safety is and always will be a critical issue for operators, frontline transit workers, and the communities you serve. Our goal is to ensure a safe ride on public transportation for everyone, riders and operators alike. As ridership continues to increase, we want to hear how we can better support local efforts to prioritize and safety. So at today's listening session, we will ask panelists to highlight best practices they're using to ensure transit is safe, clean, and reliable, and how they're telling riders and the communities they serve about their efforts. We have heard from agencies and stakeholders across the country that they want to find the best way to let potential riders know that transit is not only the best way to get from place to place, but that it's held to the highest standards of safety and hygiene. We know some riders are nervous, but we also know that there are great ways to alleviate their fears and help our customers feel comfortable again on public transportation. We look forward to hearing from our guests today about how they are bridging that gap. And to all of you joining us today, please send us your experiences, thoughts, questions, and ways we can continue to support you to transitsopen@dot.gov. To get us started today, I will introduce three of FTA's regional administrators who, in addition to overseeing billions of dollars in federal funding, interact with dozens of transit agencies every week. Later, we will turn to FTA's Associate Administrator for Communications and Congressional Affairs, Paul Kincaid, to introduce our panelists and facilitate our question and answer session. First, Terry Garcia Cruz has served as FTA's Region 3 Regional Administrator in Philadelphia since 2015, and before that led several transportation agencies, including Cincinnati Metro, as well as transit systems in Austin, Lexington, Kentucky, Poughkeepsie, New York, and Tucson, Arizona. Also joining us today is Steve Goodman. Steve is FTA's Region 2 Regional Administrator based in New York. Steve has been with FTA since 2008 and has served in the important roles of Director of Hurricane Sandy Recovery, as well as leading the office overseeing the rebuilding of transportation infrastructure in Lower Manhattan following 9/11. He became Regional Administrator in 2016. And at the end of our program, we will ask FTA Region 6 Acting Regional Administrator Don Kosky to wrap the whole thing up. I've worked closely with Don in Region 6 since he joined in 2009, and he brings a wealth of experience with over 22 years in the transportation industry. We greatly appreciate Terry, Steve, and Don's leadership. With that, let me turn it over to them. Terry, it's on to you. Thank you.
Thank you, Gail. And I'm Terry Garcia Cruz, and I am with FTA's Region 3 office, joining you from Philadelphia. And it's great to be with all of you today. We know that transit ridership has suffered significantly the past 16 months. Today's session will focus on safety messages that have been so impactful and really resonated in the community. Here in Philadelphia, safety is a primary concern as SEPTA engages in deep cleaning of their transit stops and their stations along those subway lines that are heavily traveled. And they take this opportunity to communicate it very aggressively and letting the community know that that is occurring. I'm sure many transit agencies are following similar cleaning protocols. Later on in today's session, you'll hear from Paul Wiedefeld, who is a general manager and CEO for the Washington Metropolitan Area Transit Authority. And you will hear about their approaches to safety and how they amplify their messages in the community. Both SEPTA and WMATA are partners in our region. I'm looking forward to hearing more today and learning more from all of you. So thank you for this time. And I would like to, at this point, pass it over to my colleague, Steve Goodman. Steve?
Thanks, Terry. As Terry mentioned, I'm Steve Goodman, the Regional Administrator for FTA's Region 2 office in New York. Region 2 is home to the nation's largest transit provider, York Mta. To encourage universal mask wearing on transit, MTA created a series of mask forces. These teams are comprised of MTA leaders, elected officials, staff, and volunteers who are distributing thousands of free masks throughout the system, which includes buses, Long Island Railroad, Metro North Railroad, and New York City Subway. Since the inception of the mask forces a year ago, approximately 1,100 New Yorkers have volunteered to put on a bright yellow shirt and board trains, buses, and transit hubs throughout the region to hand out free masks and promote safety on transit. To date, they've handed out more than 750,000 masks, and their friendly faces and offers of help make them great ambassadors of transit too. To moderate this afternoon's discussion, I'm happy to introduce Paul Kincaid, FTA's Associate Administrator for Communications and Congressional Affairs. Paul joined FTA in June, or should I say rejoined FTA, as he led communications and congressional affairs during the second term of the Obama administration in 2016. We're happy to have him back. So let me turn it over to you, Paul, to take us through today's panels and Q&A session.
Thank you, Steve, and thank you as well, Terry and Gail. I'm proud to be back at FTA as part of the Biden-Harris administration, working with some amazing communications and congressional professionals here at FTA. Today, we're going to hear from a group of transportation professionals about transit safety. In my role, I can tell you that it's almost as important as keeping transit safe that we communicate that transit is safe. Before we kick off our first panel to learn about doing just that, I want to mention that we have Dr. Nikki Cohen joining us from the Centers for Disease Control and Prevention. We do appreciate Dr. Cohen's participation in all of our sessions. Starting us off today on our first panel will be Jeff Nelson, Apto Board Chair, who in his spare time also serves as General Manager of the Rock Island County Metropolitan Mass Transit District, known as MetroLink, in one of the Quad Cities, Moline, Illinois. We've asked Jeff to discuss what he's seen and heard from Apto members to represent some of the best strategies to improve safety. Jeff has spent his entire career working in or advocating for public transportation, and he joined Apto in 2018. Jeff, the floor is yours.
Thank you, Paul. And on behalf of Apto, I'm honored to be here today participating in the second FTA-sponsored listening session. There's no more important topic than safety. It is a critical component in promoting public's confidence in our nation's public transit systems. Everyone has a critical role to play. These issues are complex. This is why today's discussion is so important and timely. As Administrator Fernandez has said, we are all in this together. I want to thank her and her team at FTA for launching the Enhanced Transit Safety Crime Prevention Initiative. This program provides resources to address and prevent crime on the transit systems and to help protect our frontline workers and the riding public. It also allows public transit agencies to use their FTA funds for increase in security personnel, for overtime pay, and for mental health and crisis intervention specialists. These are priority needs. We have learned a great deal by listening to and engaging our frontline workers. FTA's request for information on safety concerns is a welcome outreach in the public transit's community. Apto recently met with chief safety officers of more than 25 transit agencies to gather information on our submission for the RFI. Some of the safety issues discussed included inward and outward facing cameras and recorders, right-of-way protection for our transit workers, hours of service policies, and the increase in operator assaults, crime, and passenger violence. We're looking forward to assisting FTA as it analyzes the data being collected and the concerns being raised. Next slide, please. Apto also did a great deal of listening. When we created our health and safety commitment program on the onset of COVID pandemic, we asked the transit users what we need to do to regain confidence in riding public transit. The key takeaways were safety on public transit requires a joint effort between agencies and riders. Transit agencies need to show what they are improving the health and wellness on the buses and facilities, and the riders want to feel empowered to make safe choices when riding on transit. Based on this customer feedback, we recreated a health and safety commitment program comprised of 4 broad pledges by transit agencies and transit passengers. Today, more than 200 agencies are participating in this program. That translates into helping to keep tens of million people safe. This program, which was developed by an Apto member-led task force, was created by Administrator Fernandez when she was Apto's chair, and has helped contribute to safety and increased ridership. Thank you, Nuria. Next slide, please. Along with keeping the promises in health and safety commitment program, Apto members have tackled the safety issues head on. For example, Capital Metro in Austin, Texas launched an innovative passenger information tool that uses LED displays and includes ADA accessible features. The displays help the agency share the useful information and to reassure riders during the pandemic. Another example is Washington Metro, where Mcgady has created a series of music-themed video ads. The ads highlight real-time crowding information, expand mobile pay options, and the latest face mask requirements. And there's much more happening. In Salt Lake City, a new pilot program is installing sensors on electric buses to provide instant information about air quality. LA Metro will pursue an alternate policing program that relies more on community partners and social services. Transit agencies across the country are offering free rides, free food, and other incentives to promote trips to vaccination sites. All these efforts are helping to build confidence and bring riders back to transit. Apto is continually working on safety issues as well. We have created a new safety-related standard and inward-facing, outward-facing cameras on passenger trains. We are in the process of writing 2 important recommended practices, one on safety and security certification, and the other on bus operator safety training. And our comprehensive cleaning and disinfecting white paper became the industry go-to resource. In addition, we continue to provide safety audits, safety peer reviews, and key resources to our members. Next slide, please. Additionally, Apto maintains a major programming focus on safety and meeting and workshops. Apto will host 2 essential safety events in early October. Our mid-year safety seminar and the risk management seminar, both in Philadelphia on August 3rd through the 6th. Our Transform annual conference in November in Orlando will present the most important cutting-edge issues on concerns of transit industry. I want to conclude by reminding all of us that keeping transit safe and earning the trust of our customers is an ongoing, never-ending mission. This work is rooted in continuous learning and improvement. Last slide, please. As we keep innovating, testing new ideas, and asking ourselves what is the best newly developed Apto ridership tool can be an enormous help. This dashboard shows in real time how riders are responding to an ever-changing environment. As public transit professionals, we'll continue to be flexible, resilient, and optimistic. We are in this together, and that is how we'll emerge from this crisis is together. Thank you for the opportunity to speak.
Thank you, Jeff, for sharing those great examples. And I want to thank Apto, as well as all of our friends here, for letting us take advantage of the wealth of information you collect from your members regarding safety and other issues. To continue our panel discussion now, I'll turn it over to Kendra Mcgady, Director of Pelovin Transit and the Northeast Tribal Consortium. Kendra's work includes overseeing a rural and tribal transit program covering 7 counties and close to 4,500 square miles in Northeast Oklahoma. Kendra, we appreciate your perspective.
Thank you. Next slide, please. My name is Kendra Mcgady, and I'm the director of Pelovin Transit. I lead an operation for 5 years. I've been the director. We operate a demand response and on-demand transit system in Northeast Oklahoma, providing transportation services to 4,466 square miles. We're also very well integrated with tribal nations here and provide transportation services to 10 tribes, including the Cherokee Nation. We're the lead agency in the Veterans Ride Connect, and we are the lead agency in the PIC Transportation Project. Next slide, please. I'm here today representing the CTAA Community Transportation Association of America, of which I serve as a national board member. And I want to talk to you about rural and tribal transit and some of the things that we're doing as far as safety protocols and renewed ridership. And rural transit, at Pelovin in particular, safety has always been our #1 priority. We participate, like all other 5311 providers, in ongoing safety training that is supported by our state DOT, which has created a safety culture among operators that maintains a state of good repair with our rolling stock, and also offers very specific training, including defensive driving and CPR and wheelchair restraint, and then the basic training sessions that everyone goes through. However, as a result of COVID-19, safety in rural transit has a far greater emphasis on public health. Persistent cleaning measures and specialized training are all now part of the program. With this new layer of cleanliness that becomes part of safety in a post-COVID world, airflow has become a big issue. Disinfecting and sanitizing after every trip, installing barriers between drivers and riders, limited seating capacity, rear entry, and in rural transit, no front seat riders has all been part of the project of implementing new procedures to promote safety within our transit systems. And of course, there are the mask requirements for riders and drivers alike. With these kind of issues becoming part of a safety protocol, rural transit systems have invested heavily in PPE, including procuring HEPA filters, sanitizing wands, masks and fogging machines to maintain clean, safe vehicles. In the state of Oklahoma, our DOT opened up the state contract and provided millions of dollars worth of PPE to all rural transit providers, enabling us not only to ensure clean, safe transportation, but to provide masks to riders who maybe didn't have any. As a result of high stress levels that have been associated with isolation, lack of services, and just atmospheric frustration, rural operators have begun adding specialized training. The Community Transportation Association of America now offers de-escalation and conflict resolution training, as well as trauma-informed training. And a number of our providers have taken advantage of that. Since posting that in spring of 2021, we've seen 378 transit employees participate in that project, which we think is a true testament to the high stress levels that everyone is experiencing through this difficult time. At Pelovin Transit, in order to promote safety, we also held a vaccine clinics for our drivers. We partnered with a local medical provider to establish a clinic for drivers and staff. And as a result, we successfully vaccinated 19 of our drivers and 3 of our admin staff, which was very important, and a communication that we provided to our ridership so that they would know that we were looking out for them. In April of 2020, Pelovin completed 4,400 trips. We watched our ridership plummet like everyone did. And in this June, our ridership is up to 78%. I think that it would be even higher numbers if we weren't experiencing the driver shortage that everyone across the nation is experiencing. But I contribute this, and I'm confident that our communicating these protocols to the public has been key in this situation to see the increase in ridership. Rural providers have created videos showing cleaning procedures and posted them to social media and on our websites. We have displayed flyers in all of our vehicles. We've maintained good communication with our local news media outlets to continually make riders aware of the state of public transit and the things that we're doing to ensure safety when they're on our vehicles. With this resurgence of cases, of confirmed cases of COVID-19, I believe that this is more important than ever that we continue to communicate these protocols with our ridership. Communication is key. Next slide, please. I just want to talk a little about Pelovin Transit and what we've done here. Since March of 2020, we have 1,069 trips to our riders. And of those trips, we've had 4 incidents regarding max pushback in our system. And that was in the beginning of the COVID-19 pandemic. I believe that this has a lot to do with the essential nature of our trips and the fact that we transport the same riders day in and day out. We're very familiar and have an intimate relationship with the people that we transport in rural transportation. So I think that we haven't seen the same pushback as some other agencies may have experienced. We have maintained a full staff of 57 throughout COVID-19. And of those numbers, we have 31 drivers. And during the past 17 months, we've had 3 confirmed cases of COVID-19 amongst our staff. I think that this too is a testament to the essential nature of these trips and the seriousness of transporting individuals. I want to talk for just a second about some of the things that rural and tribal providers did during this time. We were very nimble and flexible in our delivery systems. We were able to pivot in a matter of hours from people mover to home meal delivery service. We at Pelovin Transit delivered just under 6,000 meals to homebound seniors and tribal elders, including pet food delivery. We played a vital role in protecting our communities, offering free trips to COVID-19 vaccine clinics across the nation. At Pelovin Transit, we provided 1,068 free trips to vaccination clinics for riders in our public and tribal operation. And I want to state that tribal transits, as well as they've gone through this and they fight to protect their tribal elders and citizens, they've implemented the same protocols, procured cashless technologies, which I think a lot of systems have done. And they've also redesigned routes to provide the most adequate and safe transportation to their citizens. Another way that we've been able to communicate effectively with our public is through our technology at Pelovin Transit. We used our ITS to communicate and notify riders of changes in service, safety protocols, and potential exposures in the beginning of the pandemic. I think that a number of rural systems and small urban have been able to invest in technologies throughout this that has enabled them to do the same things. I believe that the increased ridership that we are seeing is a direct result of our immediate and diligent response to COVID-19 in rural and tribal transit. Our providers have been steadfast in their protocols, keeping transmittal of COVID within our systems to a minimum while continuing to provide essential transportation to dialysis and other critical care and non-emergency medical trips, all of which contribute to maintaining a very healthy community, as we all know. I also feel we've been instrumental in keeping our country moving during this time by providing trips to frontline employees to and from healthcare facilities, grocery stores, food distribution centers, restaurants, and pharmacies. Again, I think that the communication of these protocols through maybe grassroots efforts on behalf of rural and tribal is the reason that we've seen such a great increase. And again, more important than ever is to maintain these safety protocols as we move forward in this pandemic. I thank you for your time today. And I want to reiterate the ability to provide safe and reliable transportation has always been and remains the focus of rural and tribal transit. Thank you.
Thanks, Kendra. That was very informative. It's important to learn about not just urban transit, but rural and tribal as well. Now I'd like to welcome Jim Tymon, Executive Director for Ashto, the American Association of State Highway and Transportation Officials. Jim?
Well, thank you, Paul, and I want to thank FTA for their leadership and guidance throughout this pandemic. I'm Jim Tymon. I'm the Executive Director of Ashto, and we represent the 52 state departments of transportation across the country, including Puerto Rico and the District of Columbia. For a lot of people, when they think of Ashto, they still think that we only represent the highway community. But in fact, we are a multimodal organization that focuses on highways, streets, aviation, water, active transportation, rail, and transit. Our public transportation members manage more than $31 billion in federal and state transit funding and work directly with local transit agencies to provide critical transit services in rural and small urban communities. Next slide, please. Safety is absolutely the #1 priority for Ashto and for our members. Our members, the employees of our nation's state DOTs, prioritize safety in everything they do. As it relates to safety on our roads and bridges, the number of fatalities and serious injuries that we've been seeing here in the last several years is unacceptable, especially over the last 18 months during the pandemic. To help address these issues, Ashto has been working with our state DOT members and FHWA to consider ways to help improve safety throughout our transportation network by embarking on new education initiatives and by looking at the deployment of innovative infrastructure designs and technologies that have been proven to help save lives. Next slide, please. When we think about our public transportation safety, our members think about the millions of transit riders who use our small urban and rural systems. Public transportation is one of the safest modes of transportation. And within the broader category of public transportation, we know that our rural systems are actually the safest. However, over the last 18 months, safety on public transportation has taken on a new meaning to include stopping the spread of COVID-19. And I know that our members have been up to the task in helping to address this challenge. While they still worry about crashes and the potential for fatalities, the COVID-19 pandemic really refocused state DOTs to better assist their transit agencies to keep both vehicle operators and their passengers safe from contracting COVID. And state DOTs really stepped up in this area. First and foremost, they provided emergency relief funding to help keep vital transit services in operation. State DOTs helped transit agencies procure PPE, and they provided guidance for keeping vehicles clean and safe, and for retrofitting vehicles to ensure safe and social distancing. These measures were effective, and because they were effective, rural and small transit systems kept their promise to the communities they serve and maintained operations throughout the entire pandemic. Next slide, please. It's important to remember that for a lot of people, transit is a lifeline. And in my conversations with Ashto members, I asked them about their safety concerns over the last year, and if their transit agency riders were reporting a loss of confidence in their public transit service because of COVID. Almost universally, the response has been no. Transit riders in those small and rural agencies kept riding. Despite the pandemic and all the associated challenges, transit services continued to provide riders with access to medical appointments, visits to grocery stores, and commutes to their jobs. But as Washington State DOT Secretary Roger Millar said in last week's webinar, increased ridership isn't the end-all be-all in rural areas. Access is actually the more important issue. And transit truly provides that lifeline in rural and small urban communities and for people with special transportation needs, like people with disabilities, seniors, and veterans. Next slide, please. So we've got a few examples of state DOTs prioritizing safety, especially during the COVID-19 time here that we've been dealing with over the last 18 months. While transit ridership took a really big hit in 2020, and the pandemic wreaked havoc everywhere on businesses, on housing and food service industries and more, the transit industry, specifically in small and rural areas, were able to continue moving forward because of the federal emergency relief funding that they were able to receive. That really enabled those transit agencies to be able to provide the essential services for people who needed it the most. State DOTs worked every day with their transit agencies to help keep those buses moving and those vans running to ensure public transportation services were able to be administered as safely as possible. So here are a few examples of their work. Next slide, please. The Virginia Department of Transportation was very quick to step up. They first provided state emergency funds for their transit agencies to continue operations and to provide PPEs. They also created a centralized communication network and became the clearinghouse for all information and technical assistance on COVID for their local transit agencies. In Washington State, the State Department of Transportation became a one-stop shop for information and assistance on COVID-19. And what you see up here on the right-hand side of the screen is a screenshot of Washington State's systems performance dashboard. It includes a day-by-day operational information about all transportation modes, including transit. And this dashboard was really effective in helping the governor of the state determine the phases of reopening for every county in the state. And the third example I wanted to point out was New Mexico DOT. They launched a new online training system for their transit agencies during COVID on safety and for transit operators on handling and de-escalating conflicts, which we know was an important situation for our transit agencies to be able to handle during the COVID-19 pandemic. Next slide, please. So in conclusion, I really just want to thank everyone for letting me participate in this panel. Please feel free to contact me or my staff that you can see here on this slide with any questions that you have. Back to you, Paul.
Thank you, Jim. We appreciate you highlighting those important examples about safety from our state DOT partners. It's things we can all learn from. We want to move next to our panel of transit agency leaders. We have a distinguished group. Paul Wiedefeld from the Washington Metropolitan Area Transit Authority, WMATA, Dave Eatman of Go Raleigh in Raleigh, North Carolina, and Alex Wiggins from New Orleans Regional Transit Authority. Let's kick this off with Paul Wiedefeld. Paul?
Thank you so much, Paul. And I also want to thank Terry and the entire staff at the region, all the support they give us here at Metro and DC. Next slide, please. First, I want to touch on our capital investments that we made in safety and in state of good repair over the last few years. This is important because in the past, Metro had lost customer confidence as we were experiencing safety issues that frequently impacted service. Let me begin by highlighting just a couple examples of this important capital safety work to build customer confidence, which is what we're all facing again during this pandemic. In 2016 and 17, we launched our Safe Track program, an aggressive track renewal program in which we accomplished 3 years of track work in 1 year. This allowed us to make improvements to nearly 1/3 of our track infrastructure, and as a result, reduce track defects and track-related delays on the rail system. One of our current efforts is the Platform Improvement Project, in which we are completely rehabilitating 20 of our outdoor platforms. Repairs at each station are done during a 3-month station closure and rail segment shutdowns to accelerate the work. With 17 stations completed, the outdoor stations have new platforms and customer amenities such as safer, more accessible, and more customer friendly. Next slide, please. System-wide, we've made significant capital investments pre-pandemic and during COVID. And today we have a $2.6 billion annual capital budget to support much needed capital work promoting safety and state of good repair along the areas of ongoing work and catching up. Next slide, please. Our research tells us what we're doing is working to install customer confidence, and they believe Metro is doing everything we can to keep them safe. It also demonstrates the kind of confidence and trust that will come nationally with the federal infrastructure program that we're all hoping will be passed shortly. Next slide, please. At the same time we're investing in our system on the capital side, we're also taking unprecedented action to curtail the spread of the virus among employees, riders, and the public. First, let me take a moment to outline some of the Metro's efforts to keep our employees safe from COVID-19, all of which we could not have done without the working closely with the leadership of our local transit unions. That includes the obvious cleaning and provisions of protective equipment. It also includes assistance for employee COVID testing and vaccinations. We did mobile testing program literally at some of our bus divisions, rail divisions. We set up a voluntary tracking of vaccinations, and we've put in a number of incentives to encourage the vaccination. Next slide, please. And of course, we've taken a number of steps to protect the public, which again includes the cleaning protocols and masks and the hand sanitizers that we've all been using. But we also know air filtration is an important issue to our riders, and we've taken steps to upgrade filters at our stations and facilities on Metro buses and on Metro Rail. We're piloting a higher grade filters and UVC on our buses and rail cars, thanks to the support of the FTA. We also are providing real-time crowding information and have implemented touchless fare collection for our customers for both Apple and Android phones. Next slide, please. To communicate all this in an ever-changing climate over the last year and plus has been a challenge, as we've all been dealing with. Our employees, our emphasis has been on addressing COVID takes everyone. We're all in this together, so we all need to do our part. In that vein, this year's we're running a Do Our Part campaign that spotlights all other things Metro is doing across our system to keep DC areas safely moving, including the things I previously mentioned, like contactless payment options, strict cleaning protocols, and improved air filtration. We've also developed a stakeholders toolkit, so our stakeholders can share all of our materials and information to promote Metro ridership, and are preparing next week for the next Welcome Back campaign, which starts right after Labor Day as the region starts to reopen. Next slide, please. I'd like to play one of our recent ads. I'm gonna call it Humming Right Along. Please play the ad.
$8 million hands sanitized. 1 million faces protected. 400,000 rail cars disinfected. We're humming right along, keeping you safe when you ride Metro.
Thing is, we saved a lot of money there because we used some of our employees, as you saw there. So in closing, our customer research is indicating this message is working. Customers are convinced Metro is taking appropriate steps during COVID regarding cleaning and the like. With this confidence, they now have turned their attention to wanting to know availability of service and fare offers. To that end, Metro's board recently approved a series of service and fare improvements that will enable Metro to be responsive this summer and this fall as the region continues reopening, while promoting ridership, equity, and a seamless experience. So before turning back to you, Paul, I do want to say how much we really appreciate the FTA's continued efforts to help us keep Metro open and let the riders know that transit's open throughout the nation. So thank you very much.
And thank you, Paul, and your employees at Metro. Let's turn now to David Eatman, Assistant Transportation Director for the City of Raleigh in North Carolina. David, what can you share with us about how Go Raleigh has boosted safety while encouraging North Carolinians to get on board?
Yes, thank you very much for the opportunity today. One of the primary things that we've done here locally regarding safety is continuing our suspended fares. Along with all of our regional transit systems, we are continuing suspended fares through the rest of this fiscal year through June of 2022. Limiting fares provided an added bonus for those in our community who really needed it most, including line workers, community members relying on transit to get to critical jobs, access food, and certainly healthcare during this critical time. Next slide. Like many other transit agencies, Go Raleigh suspended fares in March of 2020 so our riders could use rear doors to board the buses and help maintain social distancing, while also limiting capacity on our buses to really about half of our 40-foot buses. We were maxing out about a 16 capacity on each bus. As we also received funding, we distributed close to 10,000 masks, around 7,500 of those actually provided by the Federal Transit Administration. And certainly our employees did that directly with the passengers on the vehicles. Since that time, we've also made masks available on vehicles at any time a passenger may need a mask. Early in the pandemic, we created COVID-19 procedures and documented and managed and organized this information to develop health procedures that were implemented by all departments of Go Raleigh, really across the entire system and network. We continue to do our additional cleaning, not only on buses, but certainly at our facilities, even down to the bus shelter level. We created and promoted 5 PSAs discussing COVID-19 safety procedures for the public. And in June, an ongoing commitment to safety, Go Raleigh and our sister agencies extended our suspended fare initiative, as we just talked about. Next slide. The suspended fares really provided benefits at 2 levels. We boosted our efforts to protect the safety of our operators and riders, but we also made it easier for Raleigh residents to ride. A free trip is a great incentive, and they are coming back to our ridership is certainly coming back as we reach pretty much 70% of our pre-pandemic ridership levels. Because America is open and transit is open, we have taken the opportunity to create a marketing campaign and showcases many of our benefits of riding transit, as you can see here. We are grateful to the administration, Congress, and FTA providing revenue through pandemic funding such as CARES. As you heard about earlier, certainly CARES Act, as well as these other funds, have really helped our agency navigate this difficult time. But there's certainly that helped us with our loss of fare revenue, but even probably more importantly, allowed us to procure the needed PPE and critical supplies needed throughout the pandemic. So thank you again for allowing me to speak today. That's just a little bit of a highlight, great information today, much more to share, but thank you very much.
Thank you, David. That's some great stuff happening in North Carolina's capital and the home of the Wolfpack, and we appreciate hearing about this excellent use of pandemic relief funds. Now, I'd like to turn to Alex Wiggins, who leads New Orleans RTA. Alex?
Hey, good afternoon, everyone. Thank you so much, Paul. I really want to thank the FTA for pulling this together, of course, under the leadership of Administrator Fernandez. And, I had the pleasure of working with, now former Region Administrator Gail Lissy. I'd say it's just been a fantastic partnership. These last 18 months have been very challenging, and we really couldn't have gotten through it without the partnership of our friends at the FTA. So I just wanted to take a moment to thank them. Next slide, please. It's been a real challenge with transit service. Like many transit agencies across the country, we reduced our service quite substantially, in our case by 50% at the onset of COVID. But one thing I'm really happy to report is that we had to be very strategic about how we reduced service. One of the lessons that we learned here in New Orleans is that, this is a personal belief of mine, but transit mobility is an absolute right. So as we reduced service to adjust to, declining ridership levels, we had to maintain that critical service that connected our first line workers, our frontline workers to critical destinations, hospitals, educational facilities, grocery stores, et cetera. And so I was really happy with the way that we did go about that. We also took time to work with our partners here at the Regional Planning Commission and our partners at Jefferson Transit to redesign the entire transit network, but through a lens of equity, so we could ensure that once we came back, we could resume service in a way that better connected our riders to education and employment activities. And we're really focused on providing a level of mobility that will be almost equal to having a car. So very happy with how that New Links implementation worked out. So as of June 20th, what we found is right before June, no doubt America's open and transit is open. Our ridership returned actually before we were ready to meet their actually mobility needs. And so on June 20th, we began a phased return to full service, beginning to offer full transit service during AM peak and PM peak, and then working to adjust to the ridership demand for those periods in between. Obviously, maintaining the cleanliness of the fleet is absolutely core to maintaining the confidence of the ridership. And so like all of my colleagues across the country, we're conducting deep cleaning every 24 hours, and then doing midday cleaning as well on all of our rolling stock, all of our streetcars, all of our buses, all of our ferries and paratransit vehicles. And so that's really helping us to maintain a safe environment. And then lastly, we are installing protective barriers on all of our new buses that, thanks to FTA funding, we've been able to acquire, and then retrofitting our fleet as well, providing PPE to operators, making sure that our passengers wear masks, and in cases where passengers don't have masks, providing them with masks. So we are underway with our phased return to full service, and I'm happy to say that our ridership is really beginning to come back. Next slide, please. So in order to provide an incentive, we took advantage of a 6-month promotion to reduce the overall cost of transit for all of our ridership and all of our demographics. So we reduced our monthly pass by about $10 from $55 to $45. And then we introduced some really cool incentives to get our young folks out, to increase mobility for seniors. We introduced a $14 a month senior monthly pass, an $18 a month youth pass, and then 1-day passes, 80% for seniors and $1 for youth. What we're really hoping to do is incentivize the ridership to come back. For folks that don't ride transit on a regular basis, to show them that it's safe, that it's a mode that they can actually see as reliable and certainly trustworthy. So we launched that campaign July 1st, and happy to report that we're making good progress. And what I'm hoping by the end of the year, we'll show a substantial increase in both our ridership, which is key, and in our revenue as well, by making up sales on volume. So happy with the progress there. Next slide, please. Now, you all may have heard that Louisiana and New Orleans, we are unfortunately at the epicenter of this current peak and surge in the Delta variant of COVID-19. And so the Board of Commissioners and myself, in consultation with the medical community, took a bold step last week to actually mandate the vaccine for all of our employees. We were fully prepared for adverse operational impacts, but surprisingly, we're only a week into this. 87% of our workforce has actually met the conditions to work. Either they're fully vaccinated or received the first partial vaccine, or they filed for an exemption. And really, really encouraged by that. Our service disruptions have been minimal. Yes, we have experienced some, but they have not been catastrophic. So we've been able to maintain mobility. I'm very excited about the possibility of getting 100% of our employees vaccinated. And we took this step because this is really about saving lives. And as a transit agency, we must maintain mobility for the region. And so having a workforce that's not prepared to do that was just an unacceptable outcome for us. Like many agencies across the country, we still require masks to be worn within our buildings. And so we reinstated that mandate regardless of vaccination status during daily temperature checks for staff. And of course, now we're looking at implementing regular on-site COVID testing for all of our employees. And this is really driving at ensuring that transit is reliable and it's safe, and we can maintain mobility for the region. And so that's all we have for an update from New Orleans. And Paul, back to you.
Thank you, Alex. While being a hotspot is an ongoing challenge, it sounds like your agency is doing some great things to improve the safety for your workforce and riders in New Orleans. Now, I'd like to introduce our third and final panel. These folks join us from city and county-based organizations that have a vested interest in the success of public transportation. They provide a valuable perspective about safety as well as equity in our transportation systems. We'll begin with Irma Esparza-Diggs, Senior Executive and Director for the Federal Advocacy at the National League of Cities. Irma?
Thank you, Paul. Thanks for having us. We're glad to be here with FTA today. If you can move forward to our next slide, we'll get right into it. The National League of Cities has been behind our cities and towns and our transportation partners every step of the way during this pandemic. And we know that we're emerging stronger and with greater optimism that together we can create the communities where we can safely live, work, and play. And we've already been through so many stages of transit during COVID-19, from stepping up cleaning to providing rides for essential workers to ensuring vaccination transport options to educating the public on how we can all do our part for a safe ride, such as wearing a mask. Transit is always on the front lines of our communities, and they've been a terrific partner in both keeping America's cities, towns, and villages open and moving safely. Next slide, please. I want to say here, thank you. Thank you to all of you all, the transit leaders, for all of your efforts to serve our cities and towns during these trying times. We appreciate you, and we appreciate the efforts you're making as we come back to full strength. We know riders are coming back, and we appreciate that you are preparing now to make that happen. And while the COVID-19 pandemic uprooted all of our daily routines and they changed how we move as cities, we were impressed by the nimble changes we saw from transit providers to adapt routes and shifts and to increase safety and cleaning protocols. We know your quick response innovation is something that will keep benefiting riders and operations post-COVID. We also recognize that the inequalities that were laid bare during the pandemic in health, education, housing, job security, and of course, transit are issues we can continue to improve together in partnership with FTA and with Congress's support. Next slide, please. Cities believe that the data-based approach to innovate transit and measuring for equitable, consistent service is going to show us how well we're all serving our neighbors and all of our neighbors. We know it will lead to more success stories, more connectivity, and perhaps even new places. So if you're new to these types of efforts, take a look at NLC's free resources, such as 3 ways that cities can measure and tackle transportation equity, with examples and case studies from cities like Portland, Baltimore, and Nashville. We are seeing new metrics and measurements for the unequal commute to show where improvements can be made. Before COVID, expanded mobility in cities was radically improving year over year, and we look forward to expanding that work together with our transit operators and communities. As we look forward, NLC knows that transit will continue to keep pace with the heartbeat of our communities, and we look forward to continuing to collaborate and serve our residents with you. Thank you.
Thank you, Irma. That was illuminating, and we learned a lot more about the National League of Cities and its work on transportation. Now I'd like to turn the conversation to Joy Cheney, the National Urban League. Joy serves as Executive Director of the organization's Washington Bureau and Senior Vice President for Policy and Advocacy. Joy?
Good afternoon. My name is Joy Cheney, and I'm the Executive Director of the Washington Bureau and Senior Vice President of Policy and Advocacy at the National Urban League. The National Urban League is a historic civil rights organization dedicated to providing economic empowerment, educational opportunities, and the guarantee of civil rights for the underserved in America. Founded in 1910 and headquartered in New York City, the National Urban League has 91 affiliates serving 300 communities in 36 states and the District of Columbia. We provide direct services that impact and improve the lives of more than 2 million people nationwide each year. Next slide. I tell you this because, as the map shows, our affiliates are located in cities with the greatest need of safe and reliable public transportation. And so we are so appreciative of the opportunity to join today's conversation. Our President and CEO, Mark H. Morial, joins me in thanking the Federal Transit Administration and its able administrator, Nuria Fernandez, and her team, and Secretary Buttigieg and his team for holding these listening sessions. For 45 years, National Urban League has published The State of Black America, which serves as a pulse check on the state of progress for Black people in this country. This year's report is entitled, quote, The New Normal, Diverse, Equitable, and Inclusive, and focuses on how our nation can recover from the 3 pre-existing pandemics of systemic racial inequality in healthcare, the economy, and public safety, beginning with Black America, but toward a new normal for all. We know that transportation is a fulcrum point in our ability to bring about this new normal. One of the areas in which we provide direct services is in the workforce development arena. Over 2/3 of our affiliates offer some version of workforce development and job training programs to their communities. One of the things we have learned is that transportation remains a significant barrier to stable employment, small business growth, and the basic benefits of the post-segregation era, especially during this COVID-19 pandemic. Public transportation redlining in low-income communities and in communities of color has left far too many caught off from better employment opportunities and life that extends beyond one's block or neighborhood. And for small businesses who participate in many of our entrepreneurship programs and are often located in neighborhoods underserved by public transportation, the lack of access to consumer foot traffic has made it almost impossible to grow and build wealth. So the Urban League movement is particularly interested in what happens at the Department of Transportation, beyond our obvious interests in ensuring jobs for communities of color and contracts for businesses of color on transportation projects. And because today our focus is on safety, let me echo what my fellow speakers have already said. Even where you have access to public transportation, the pandemic has made many fearful of public transportation, further isolating them from the rest of the world, from jobs to healthcare to retail and to personal services to church, to life. And while we are hopeful that vaccinations would make people more confident in public transportation, vaccine hesitancy and the rise in the Delta variant, coupled with recent memories of frontline transportation workers having a disproportionate illness and death rate in the early days of the pandemic, kept of public transportation far higher than they should be based on the science. So, like the FTA and DOT, the National Urban League has transportation programs aimed at getting Americans back to work, beginning those who cannot work from home. Next slide, please. In January, Milwaukee Urban League, under the leadership of President and CEO Paul, launched the Leading Access to Success Transportation Program, better known as the Last Mile Program, which provides workforce development clients with temporary transportation to their job sites. The program picks clients up from the Milwaukee Urban League and takes them to their employers. Last Mile programs provide transportation to employers not accessible by public or other transportation services. Next slide. The National Urban League also has a national partnership with Lyft that is aimed at distributing ride codes to essential workers and their families so they too can get to work. Moreover, the Urban League has partnered with Lyft and Uber to ensure Americans and those in need can get access to their vaccination appointments. And last fall, we ensured that they could get to the ballot box safely by having programs around voting. We wanted to remove all barriers. Next slide. And finally, that is what we encourage the Federal Transit Administration to continue doing. We are very pleased. We know you're already doing it. We want you to lean in even further to remove all barriers to safe, reliable, and accessible public transportation throughout America. In this Build Back Better moment, as we all work towards creating a new normal that is diverse, equitable, and inclusive, never forget that transportation is a pathway to jobs, and transportation rights are civil rights. What you do here at the department, and what all of you who work in transit, who are speaking today or who are just on the call, do is vitally important to the success of our nation, especially in communities of color and low-income communities throughout rural and urban America. The National Urban League looks forward to working alongside you in furtherance of our common goals. Thanks for the opportunity to present today.
And thank you, Joy. We really appreciate it. It's very helpful to get your perspective. After all, urban areas were where the birthplace of transit was, and the origins of FTA as well as the Urban Mass Transit Administration. Now we'd like to turn it to the National Association of Counties. Mark Rotaco is with us today. Mark?
Thank you so much, Paul. I'm Mark Rotaco, and I serve as Director of Government Affairs for the National Association of Counties, or NACO. Really, thanks so much for having me today. It's truly an honor to be on a panel with these speakers. Next slide, please. And these speakers are part of this important conversation, which is also important for counties who, as you may know, directly support 78% of public transit systems, in addition to owning and operating more roads and bridges than any other level of government. We as counties invest $134 billion in the construction of infrastructure and the maintenance and operation of public works. That's all to say that counties play a critical role in the nation's transportation and infrastructure network, and we appreciate our intergovernmental partners at the FTA for inviting us to be a part of this event. As the COVID-19 pandemic unfortunately continues, our local and regional transit systems are connecting folks with critical services, all while facing unprecedented drops in revenue at the fare box, as we've heard from other panelists today. This is just one of many contributing factors to the hundreds of billions of dollars in budgetary shortfalls America's counties are facing as a result of our frontline response to the pandemic. Next slide, please. For this reason, NACO has strongly advocated for additional federal COVID-19 relief in the form of direct and flexible aid to counties of all sizes, which has helped the efforts of local governments to rebuild our communities and economies tremendously. However, with the number of cases once again, unfortunately on the rise, we know that this fight is far from over. COVID has exacerbated the need for investments in our transportation infrastructure and highlighted the inequities impacting millions of county residents. Before and during the pandemic, NACO has remained focused on promoting county infrastructure priorities, including direct funding opportunities for locally owned infrastructure, improving and expanding public transit systems, strengthening and enhancing access to broadband, and increasing and reimagining safety and accessibility. Next slide, please. To talk briefly about some of our work in these areas, at our recent 2021 annual conference just last month, our members voted to add a new section to the American County Platform, which is a policy document voted on by NACO's memberships. And this policy was regarding safe street designs for pedestrians and cyclists. Counties are dedicated, as we see from this resolution, to prioritizing the safety and comfort of all users of America's roads, including pedestrians, cyclists, commuters, and drivers. Further, counties are aware of the critical importance of expanding access to broadband technology. Beyond being a basic necessity, high-speed broadband is also an accelerator of opportunities in these communities. The NACO Broadband Task Force recently published a new report detailing how high-speed internet is essential to all aspects of life in counties, and you can find that at naco.org/broadband. And now, turning to the larger issue of improving and expanding our public transit systems, counties are deeply invested in public transit to keep our residents, economies, and communities connected. A common theme of each of these items that I mentioned just now is equity. Equity in transportation and equity in society as a whole. Equity in public transportation for us means equity in access, reliability, quality for users of all roads, as well as planning and development. Public transportation is critical to connecting people with employment, healthcare, recreation, and other aspects of their community. And counties are dedicated to ensuring fair access at the local level. Addressing both equity and economic development, counties across the country are pursuing transit-oriented development opportunities, connecting transit hubs to commercial, residential, employment, and entertainment centers in high-density environments, not only to help boost transit ridership, but also to revitalize these neighborhoods, to increase affordable housing and improve congestion and reduce emissions. Counties are so excited to see investments in all modes of transportation, as I just described, is a major part of the congressional bipartisan infrastructure package that Congress is currently negotiating. And as these federal policymakers continue to prioritize the need for more connected communities, NACO and all of the nation's 3,069 counties stand ready to work with partners with Congress and the White House and all of you to ensure our transportation and infrastructure systems are safe and efficient and accessible to all. So that concludes my remarks. Thank you so much for having me.
And thank you, Mark. The National Association of Counties' support and advocacy for the transit industry is always appreciated, as is your work to make the connection between public transportation, economic development, and equity. Finally, I'd like to turn to our last speaker, Chris Van Icken, Senior Program Associate with Transit Center. Chris recently published a report called Safety for All that focuses on safety and security in transit. I couldn't think of a better resource to help us learn about it today. Chris, thank you for joining us.
Thank you, Paul, and thank you to your team for having us on this call today. Just to start off, I'd like to introduce Transit Center. We are a New York City-based but nationally focused foundation that advocates for better public transit in order to build more sustainable and equitable cities across the US. Next slide, please. Last month, we released our Safety for All report, which was our look at transit, policing, and safety issues across the US. We decided to do an evaluation of the issue after the protest of last year at Black Lives Matter. And we looked at what transit safety models currently look like and did a review. Current models of transit safety are falling short of their stated goals. There's an over-reliance on policing, and policing cannot address the social ills that lead to dysfunction on our systems. Agencies must take steps to develop more holistic safety programs that help connect riders with the services that they need. Safety means different things to different riders and different groups of riders. So agencies will have to take care to carefully balance their needs and make sure that they are, meeting their riders where they are. Next slide, please. As many know, modern transit policing sort of grew up on the New York City transit system. It's where broken windows theory was first employed. And there we saw a focus on low-level offenses to prevent more serious crimes from occurring. And it did reduce the incidences of crime, especially serious ones in the New York City transit system, but it had a disparate impact on Black and brown riders. And it led to an unfortunate pattern of police abuse and racial discrimination. This, in tandem with the erosion of non-police public services, has led to an over-reliance on police officers to maintain safety on our public transit system. Police officers are doing too many things in our systems. They're acting as fair enforcement agents. They're being public health advocates. They're being customer service agents, when we need them to focus on keeping violent crime down and protecting our operators and maintainers. Next slide, please. Among 3 issues that we looked at specifically, fair enforcement was one of them. Fair enforcement is a common source of friction between riders and police. It's where we see lots of conflict. We suggest the use of unarmed and fair inspectors and ambassadors when you are able. This is a system being adopted across agencies. BART and TriMet are sort of leading the way here right now, and they've seen some success here. And we would like to see this adopted more widely. Agencies, when they begin to seek alternative methods of lowering fare evasion, should think beyond policing and think more deeply why their riders evade the fare. Studies have found that, Monash University study found that something 40% of riders were evading the fare because they left their fare card at home, they were having a trouble with turnstile, or it was simply easier than paying the fare. It's not because folks want to, rip off their system. So we need to think of ways to get them to pay. Some of those ways are ensuring that reduced fare programs are easy to sign up for. Some are changing fare evasion penalties and making it less burdensome. So riders are signing up for programs. And other ways are, as I stated before, using unarmed personnel to enforce the fare. Next slide, please. Police are often called upon to deal with homeless riders, and this is an inadequate solution. Homeless riders need assistance and connection to social services. The scope of the homeless crisis extends beyond the reach of transit agencies, but agencies still have to be proactive and build partnerships to solve the crisis. An example we looked to here was SEPTA's Hub of Hope program. It's a positive example. It's a partnership that SEPTA has formed with Project Home in Philadelphia, and they've set up a resource center in their Center City station where riders can go to get food, a warm cup of coffee, and be introduced to social services available to them. And this has the effect of allowing the homeless population to be connected to restorative justice rather than just being kicked off the system. Next slide, please. As agencies move towards more equitable transit safety programs, they should carefully consider their process. Months of work will be necessary and to adopt comprehensive reforms and propose them and implement them. In the short term, agencies will have to be transparent with their riders and with their communities they serve, share data when you can, listen to and learn from riders and community groups, hold open forums where people can discuss what safety means to them. Increase system presence through the use of unarmed personnel. System presence is very important for people's feeling of personal safety. Unarmed personnel, including just having your staff ride the system with name tags, is an effective way of doing that without increasing police presence. And reduce the use of police officers in response to fare evasion, homelessness, and mental health crises, and allow them to focus on policing violent crime and protecting operators and use them most effectively. Thank you, and I will pass it back to Paul.
Thank you, Chris. That was really eye-opening. Your report has raised a lot of food for thought here at FTA and in the industry about safety and security on transit. We've heard today how messaging is vitally important to renew transit ridership. So let's see if we can dig a little deeper. I hope our panelists will indulge a few questions to see what more we can learn. If you can each limit your answers to about 90 seconds each so we can get everyone in, that would be great. First, we'll turn to our industry reps. We heard a lot of great examples from you earlier about ways that transit agencies are addressing the issues of safety. What are the most effective ways you've seen transit systems restore confidence in the safety of public transportation in their riders? We'll start with Kendra, then Jim, then Jeff Nelson. Kendra?
Thank you. For Pelovin Transit, I'm going to speak on my behalf here. In Oklahoma, in particular, we're across the nation as a whole, but in Oklahoma, we're seeing cases rise very steadily, including 2 counties that I provide service to, which is seeing the highest and most rapid increase in the state. So I think that as we move forward in this, we've been down this road once before, but we still don't know what things look like. So I think that as we move forward, the most important and valuable thing that we can do is continue to communicate with our public what we're doing, and to retrofit the vehicles, to provide the necessary PPE. As we all know, optics are everything. We need to be enforcing that drivers and riders wear their masks continually. We need to be enforcing and promoting the cleanliness between vehicles. In rural, we are cleaning after every trip. That's what we continue to do on a daily basis. And again, reaching out to your media outlets, utilizing your technology to communicate with your ridership what is taking place as far as safety protocols go is very vital to our ridership at this point. I think that investing in technologies, if that is at all possible, is a good move right now. I know that for Pelovin Transit, we've seen an increase in our automated pay system of about 4,000 users in the last 17 months. So I think that that is incredibly important, is just to continue to push forward with PPE and maintaining these very important protocols and not allowing ourselves to get complacent or compliant with it, but continuing to push forward and stay on top of things so that the public continues to know that it's safe to ride public transit.
Thanks, Kendra. Jim?
Well, thanks, Paul. As I mentioned in my presentation earlier, there were 3 state DOTs that I highlighted that helped restore confidence in safety of the public transit services that they offer. Virginia provided state emergency funds to keep transit systems running at the height of the pandemic and help those transit agencies procure PPE. Washington State established that system performance dashboard. And New Mexico provided online training for transit agencies on how to handle and de-escalate COVID-related conflicts, which we know was an extremely important issue for us to deal with, especially at the beginning and throughout the height of the pandemic. I know there are similar examples that exist throughout the country, but some of the themes that we see across agencies are making sure that we keep the lines of communication open between state DOTs and the transit agencies in those states, proactively leading discussions at all levels of government, and lastly, making sure the transit agencies had access to the necessary resources, including funding and training and guidance that will help them deal with all of the challenges that they come across.
Thank you, Jim. And let's hear from Jeff Nelson from Apto.
There we go. Thank you, Paul. I'm going to answer this on a perspective from a transit DO. We've communicated that the expanded hygiene in our buses and facilities is a new benchmark that's here to stay. The two-step process of clean and infecting we put in place helps riders and employees feel confident. People to see what we've done to keep them safe. This is the new expectation for our riders and our employees. In our marketing materials, the driving force of confidence was our tagline. We're now shifting to ready to ride and reinforcing those same health and safety messages with new messages that are welcoming back riders to transit. We've worked hard on a continued 360-degree engagement and communication with our riders and employees on how we are keeping them safe. Engagement is especially critical now in our recovery effort. Our community surveys we are currently fielding are asking the questions that will help us shape what our service will look like in the future. Again, thank you for this opportunity, Paul, and this is a great day to really hear some good feedback and successes in our industry. Thank you.
And thank you, Jeff. We appreciate what you shared with us there, and we appreciate what our transit agency GMs have shared with us previously in their presentations. I want to give each of them now an opportunity to highlight the promotional campaigns that have been most effective in convincing people that transit is safe. What can you all share with us as best practices? Let's hear first from Alex, then we'll go to David, and then Paul Wiedefeld. Alex?
Hey, thanks, Paul. You know, the social media campaigns that have really been effective here in New Orleans is we kind of, sampled local music and local artists to actually develop campaigns that promoted social distancing, working, of course, with social media and then traditional media to actually do what was just mentioned earlier, is actually have the public actually see our disinfection and cleaning efforts, and then taking that to the public where they can actually be reassured that we're taking this seriously. So combination of social media and traditional media, and of course, some witty adaptations of local music.
Thanks very much, Alex. David?
Yes, I think certainly for Go Raleigh, it's been, we think of, you think of it as basic things, but very effective things, such as the mask giveaways and certainly having masks available on vehicles continuously, as well as signage, not only just on our buses and at our stations, but really at a stop level, reminding people to wear the mask and to keep your distance and follow safety protocols, as well as what others have said, really making sure that our riding public understand the efforts that we're taking to keep our buses and our facilities clean and ready for service.
Thank you, David. And now lastly to the GM of the transit system I ride, York Mta, Mr. Paul Wiedefeld. Paul?
Thank you, Paul. Yes, our Doing Our Part program, I think, is probably the biggest one because it basically says that, yes, we have to do things, but also our customers need to. And I think being straight up with them that they're part of the solution, I think is very important. And one element of that is we did a stakeholder involvement and stakeholder kits, where basically we're giving them the information that then they can put in their own form and talk in their own language to their people, whether it's a restaurant owner or a big corporation like Capital One or the federal government. And so that's, I think that is very important that we don't just do it, obviously, with commercials and everything that we're doing, but really it's a grassroots effort that, again, says, no, you're a part of this and you need to be at the table with us to get people to come back and feel safe.
Thank you very much to all three of you. And now turning to our organizations that help support transit outside of the actual operations, we are in unusual times, to say the least. What do you all see now in 2021 that's different than 2019 in the confidence levels of people as they consider returning to transit? What more can we do to promote the idea that transit is safe? For this one, let's start with Chris, then we'll move on to Joy, Mark, and Irma. Chris?
Yeah, I think the continued trend of low ridership is definitely impacting people's feelings of safety on the system. I think increasing system presence through the use of customer service agents, or just like having your regular maintenance staff and operators just better identify themselves within their system would help people feel like they're not so alone when they're sitting at a bus stop or in a train station. I think that in the short term, that's like a way we can help bolster system presence, but longer term, we need to think more about environmental design, ensure that there are better sight lines and fewer blind spots in stations and at bus stops, make sure that lighting is better so people don't feel so alone, and make sure that we have improved ADA access and that street environments near stations and bus stops are hospitable to pedestrians so people feel safe walking to and from their transit ride.
Thanks, Chris. And I know ADA access is one of the really important parts of the new infrastructure deal that's currently before the Senate. So hopefully once that gets passed, that's definitely one piece that we can look at. Joy, moving ahead, what are your thoughts?
Yeah, I want to associate myself with every single thing that Chris said. I think the other thing is making sure that you have a real campaign that's aimed at people on the benefits of public transportation. And when you make improvements, making sure they know about those improvements. So if you have greater lighting and you have customer service agents and you are aimed at making public transportation more accessible, both for those who, are disabled or those who just, need a little extra assistance, right? I think that is letting people know about it. I think so many of the positive things that we are doing and have the potential to do in this administration will only go as so far as people know about them. You can also partner with third-party intermediaries like the National Urban League, but also others who can get the word out to not only employees, right, potential customers, but also small businesses to encourage them to encourage their employees, you know, to take public transportation. And it also has to be reliable. People have to know when they're on, not only are they safe, but they'll get to where they need to go on time.
Absolutely. Thank you, Joy. And now let's move on to Mark.
Thank you, Paul. That was a great answer, Joy. And while people are still hesitant to get on transit, county officials are doing our part, certainly at the local level, to keep residents safe from installing safety partitions between passengers and staff on transit and in stations, setting up masks and hand sanitizers dispensers throughout transit systems. And of course, what we all should be doing is encouraging people to get vaccinated, both riders and staff. Counties are also taking a more innovative approach to getting people back on transit by reducing fares, changing schedules and service patterns to better suit a public that in many places is still working from home. And doing other common sense things like on buses, for example, using backdoor boarding to increase social distancing and also to ensure reliability of the schedule.
Thank you, Mark. That's great. And now last to wrap us up, Irma Esparza-Diggs. Irma?
Thanks, Paul. I think Chris, Joy, Mark drove home some key points. I will just add, I think partnership with municipalities, local leaders, really focus on equity where those gaps are, particularly that we saw as a result of the pandemic. We are all leveraging the ARPA, the American Rescue Plan Act dollars. We are all continuing to invest, and we're thankful we have the resources to do so. Today, as you mentioned, Paul, there is historic funding being proposed with a 65% increase for transit in what Congress is considering today with the Infrastructure Investment and Jobs Act. We look forward to continuing to innovate, right? And adding more reliable services for the residents we all aim to serve. And we have a part to play in that. And city leaders are very much there, right on the front lines with all of you all. And we look forward to doing more together. Thank you.
Thank you, Irma. And you're absolutely right. We hope that the Infrastructure and Investment and Jobs Act will pass. Obviously, it does have a great deal of investment in security and safety on transit, as well as being the largest single investment in transit infrastructure in the history of our country. I want to thank everybody today for a great set of ideas and for imparting a tremendous amount of wisdom that you've earned over your careers to us here today. We appreciate everyone's participation, and I hope you'll continue to join us in our national conversation, America's Open and Transit's Open. We have 2 more sessions planned on Friday, August 13th. We'll explore ways to increase ridership with a focus on building community partnerships. Then we'll wrap up and summarize everything we've learned at a Transit Renewal Initiative Summit in a few weeks. We hope you'll register on our website. Please visit it at Transit's Open or at transit.dot.gov/transitsopen. And now to wrap up today's listening session, I'd like to turn it over to another one of our great regional administrators, Don Kosky, who's Region 6's acting administrator. Don?
Thank you, Paul. Hi, everyone. I am Don Kosky, joining you here today from Fort Worth, Texas. I am just so encouraged by what I've heard today, and I continue to be amazed at the knowledge and creativity that our transit partners bring to the table every day. I do want to provide you with one last example before we break. Here in Region 6, our largest grantee is the Dallas Area Rapid Transit, or DART. DART stepped up to protect their bus operators early on. Starting in March 20 of 2020, DART installed several hundred shields throughout the bus fleet to help protect both operators and passengers. The shields were designed in-house with input from DART's own maintenance and bus driver teams, and they are made of high-impact plexiglass. DART actually retrofitted its initial plans for installing those barriers in response to COVID by both expanding the shields forward towards the windshield and also upward towards the ceiling to provide greater coverage and protection. Shields are now available on 100% of DART's bus fleet. This safety initiative of DART's is just one of the many creative ideas we are seeing as we seek to tell everyone that transit is safe and that everyone should be able to ride without fear. With that, in my role as the last speaker, I would like to thank everyone who presented today and those who participated in the Q&A. And I also wanted to send appreciation on behalf of FTA Administrator Fernandez to everyone who took time out of their busy schedules to tune in and listen. FTA is committed to helping renew ridership, and we know that all of you are as well. Thank you.
Thank you, Don. And thanks again to everybody who's participated today and in our first listening session. Before we close, I want to draw your attention to a list of all the organizations we've heard from today. You might want to take a screenshot of this image for future reference. Also, we plan to post this presentation and the recording on our website. We look forward to hearing from you about your ideas about how we can help renew transit ridership in the United States at transitsopen@dot.gov. That's transitsopen@dot.gov. I also encourage all of you to follow FTA's social media accounts, where we'll be highlighting many of the best practices and transit agencies that you've heard from today. From Washington, D.C., thank you for joining us today.